अस्सलाम वालेकुम जी, दिस इज़ उसामा जाहिद एंड आज हमारी जो वीडियो प्रेजेंटेशन है वो है एविडेंस बेस्ड प्रैक्टिस की। और हमारी जो रिसोर्स पर्सन है उनका नाम जी है नाम शरफ। हमारी जो वीडियो प्रेजेंटेशन है वो है जी हमारी क्वेश्चन है बेसिकली, उसके ऊपर हमने प्रेजेंट करनी है। व्हाट इज़ मेंट बाय ITT इंटेंशन टू ट्रीट एनालिसिस। Now we can describe about that. Intention to treat analysis is the gold standard of randomized clinical trials. In the analysis, data from all the subjects initially enrolled in a clinical trial are used for the analysis of efficacy and safety. Intention to treat analysis are counter-nutritive in an analysis of the treatment received as treated analysis. The effect of a therapy is judged only in the patient who actually received the therapy. In an intention to treat analysis, patients are evaluated on the basis of the group on which they were randomly assigned, regardless of whether they are actually received the therapy. Although as treated, whether they actually received or not, and patients who don't adhere to a given therapy may differ significantly from those who do and often have higher even rates for that who adherent patients. A modified intention to treat analysis include all randomized patients that meet specific minimum standard or sample set or criteria. The criteria should be simple, objective, and very straightforward. The criteria should be related to the outcome. If you know the patient with a lower socioeconomic status will be less likely to respond to your interventions, you cannot use the socioeconomic status of the criterion. Using the subjects of the criteria defeats the purpose of the modified ITTs. The more common modified ITTs will include all patients who received at least one dose of the study interventions, regardless of what regardless of what happened to the patient after the initial dose. The study protocols should be uh, pre-specified to a modified ITT analysis and its criteria. Otherwise, selection bias can occur. If you find the criteria characteristics correlate with the poor intervention response, you could later exclude patient with the characteristics from the analysis. Another common modified ITTs. Usually, the primary analysis should be an ITT analysis, but in some rare cases, non-inferiority, non in non-inferiority and equivalence trials. Modified ITT may be appropriate. Modified ITT analyses are relatively common, and secondary exploratory analysis determining whether it includes sites and protocols of violation can be challenged. That's all for the assignment, and Assalamu alaikum.